exciting to walk in and just hear the energy that was in this room. So congratulations to all of the leadership and all of you for saying it's important that we think about issues in our community and that we give to the issues that we care deeply about. I'm going to talk a little bit about so the Women's Foundation is a 35-year-old foundation statewide that has this vision of a state where women and their families thrive. And we utilize 4 different strategies to do that, which I'll talk about in a minute. But where I want to start is where you are, which is how does what you're doing fit into this statewide foundation? So it's from our inception, it's been important for us as a foundation. We were founded much like you were, right, by a group of women sitting around a table and saying not enough resources are going to organizations serving women and families, women and girls. And with this value, not only of getting additional resources to women and girls, but with this value of empowering women as philanthropists themselves. So this work of Giving Circles.
Amina Farah is case manager at the International Rescue Committee, and she focuses on refugee resettlement and health advocacy. And prior to IRC, Amina was a coordinator of the Somali Women's Program in Women's Health Institute in Toronto. She has a BS from University of Phoenix in Social Sciences with an emphasis in health and human services, and is, drumroll, a MSW candidate for the University of Southern California. Sarah Abdi is the director of United Women of East Africa support team. She's a Somali refugee herself, and she's passionate about education and character building. She's a program coordinator at the City Heights Wellness Center, and not only does she oversee the program, but it provides education and support for Somali and East African mothers. In 2006, the California Wellness Foundation recognized Sarah's work by naming her a California Peace Prize honoree. Zara is CEO and co-founder of La Maestra Community Health Centers and the La Maestra Foundation. With over 25 years experience with community organizations and nonprofits, Zara has been recognized locally and nationally for her health and social services advocacy for diverse populations.
There's the Sunday care at the Saturday right now. It's like the time, nighttime. Mother cannot go to school in nighttime. The county of Sahara correct me because I know county pays some child care, but not for
short time.
Short time. So when you starting from ESL, when you need it, how can you become self-sufficient? And how can you, I think it is the crucial to have employment integrating for the community, not working. When you have a job, you can get it more. When you don't have it there, when you don't learn language, when you have many children, when the religion is there, and they say, I have to pray. Thank God my employees, they remain with the prayer time. I forgot sometimes, oh, who was the prayer time? But some of them, they got fired. I know some young girl, she got fired.
Navigating the system was really hard. So we come together and we walk to the clinics like Sarah clinic, different clinics, and we say this is who we are. This is our. This is what we need. We don't like medication sometimes. We are human beings. So it's kind of like relationship. We all human beings. At the end of the night, we all go to the bed. So if we have bed, right? So it's like how can we talk to each other? How can we understand each other? I talk about neighbors in back Somalia or Africa or in countries. You don't have sugar, you knock the door next door and you can borrow sugar. You don't even have a food, you go to the next door and you eat with them. But here, like I remember we had a telephone issue and the guy came and he was like, I smell food, what are you guys making? We were like, here, eat. And he's like, no. In our culture, if you come to our house, you have to eat. So I'm like, here, please eat. And he's like, no, I cannot eat. I'm like, You don't like our food?
The more we can bring into the community where we have the translation and the transportation isn't an issue, and people feel comfortable because they've developed now a bond with their medical provider, their medical home, so now they're going to be bringing other questions, other issues. So where I was going is that, let's say somebody comes in and they're going to the microcredit program, they're talking about, yes, they want to grow the business they have in their own home, and they want to now buy a piece of equipment and expand that, start hiring other people. Well, they'll start talking every week about, gee, what are some obstacles to me growing this business? Then you find out, well, they need to know about a savings account, how you save money, why do you need to save money, what is a credit, why do you need to have good credit if you want to build your business? How do you develop a business plan? And so all of this is tremendous.
The federal funding from the refugee State Department, and also they get the for the individual funding. So that's what they get in. The volunteers we get from the university, and also what's called AmeriCorps. We have
AmeriCorps.
AmeriCorps, yeah. So we have it in that, and other volunteers who just want to, like the doctors, the nurses, for the refugee who speak languages and want to get the experience. So sometimes we allow them, the refugee, to get, and if we get the position, also we hire. That's how I get hired for the IRC also. When I was coming the first time and I couldn't find a job, and I was volunteering with them, and then they hired me. So most of the people who's working in IRC, we volunteer, and then if they have a position, they hire, for that, but they get the funding for the federal and the individual. Because the whole organization was born because of the women want to do something. So we have about 200 women who are members of our organization, who have kids and who just want to be part of the organization. Thank God, we also have funders like Prize Charities, California Endowment, California Wellness, so who provided us fundings.
Volunteers are really cool. We have a lot of them. But you cannot depend on volunteer doctors to be there every day. If we're lucky, the specialists that we do get some good volunteers from the different healthcare organizations that we've collaborated with over the years, like Kaiser. We have a pulmonary cardiologist from Kaiser that comes every 2 weeks. Now, when would our population ever have access to pulmonary cardiology? A lot of the specialists do not want Medi-Cal populations anymore, or anybody else that is not does not have private insurance, because they could be getting so much more for that visit. So unless they're really dedicated to set time aside and do this, you don't get those services into the community. And that's been part of our job, is to bring those specialists into the community. And once they come in, they're like, wow, I didn't know that these populations with these needs are here. I thought I was going to have to go to some other country, 2 weeks out of the year. Well, you can do that too, but you could take 3 exits off the freeway